I think most nurses start out, bright-eyed and bushy-tailed and starry-eyed, and we're so excited to enter the profession. When you get your first badge and you can write RN after your name after you pass your registration test. You're so excited to like go out there and change the world. But then the realities start setting in. Sometimes it was hard to maintain my original optimism about the profession, especially when the pandemic hit. That really exacerbated some of the structural and systemic issues that have persisted in our healthcare system. Certain areas that have been chronically underfunded, other areas that are where the workplace environment is poorly understood and poorly supported. The aftermath of the pandemic, when we are still recovering, I really felt like we lost about 15% anecdotally of our workforce across the board. Nurses, healthcare aides, MRI technicians, people who draw the blood, phlebotomists, the whole nine yard. It just felt like we were operating with 15% less people, and the 85% who are still there were all people who had lived through the pandemic together. And we were just so tired and felt like our whole system was coming apart at the seams. And when that's happening, the patients are the ones who are suffering the most. And we have these long waits in emerge, and we have overfill bed capacities in hospitals and just chronic short staffing, and people are in such a poor work environment that even more nurses leave, and it's just this vicious cycle of patients suffer the most because they don't get the quality care that they need and deserve from our system. The government has slowly begun responding to this. They've opened more spots for doctors and nurses in our med schools and our nursing schools in Alberta. But the master's prepared nurses that are needed to teach the new students who are sitting in those seats they don't just pop out of the ether. so now we're really having a crunch in nursing schools as well. I can't speak to med school, though I would guess that their situations are similar, but we are having a crunch where we don't have enough instructors, or we have to fill teaching positions with people who are not well qualified, don't have a master's, or haven't had previous teaching experience, and they're expected to teach these nursing students at the undergrad level. I was just chatting about this with one of the coordinators at UC, advisors at UC for the UC nursing school. She was saying that they have opened all these new seats, and now they're not sure how to split up the lectures, because if they have a large number of students attending a single lecture, now they have to compete with other departments to book the extra large classrooms that can fit everyone in one room. So it becomes a whole lot more complicated than it seemed at the time, when the solution was come up with more nurses. Then when you start trying to come up with more nurses, it's more complicated than it seems. Yeah, the RNet scholarships really help because they support more nurses to pursue master's and PhD degrees, because those are the people we're going to need to bring up the next generation and support them so that they are well trained when they enter practice, because this is a tough time to enter practice for the first time as a registered nurse. So we really want these well supported masters and PhD prepared nurse educators to give these new grads the best training possible so that they succeed and they stay in the profession, and they don't get so overwhelmed or discouraged that they leave. I'm really honored and humbled to receive this CWB Indigenous Health Scholarship. I think that there just needs to be, it just really helps support study from work that supports partnerships between Indigenous and non-Indigenous people within the healthcare system. We need support to learn about our role, as Canadians in how do we contribute to improving or to supporting the strengths of Indigenous peoples and bringing those forward in healthcare and reducing the discrimination and racism that they experience. But we have to really dig into what's our roles and talents that would help us to contribute to that. And so I think that the Indigenous Health Scholarship is one way to support that work. And I'm hoping as we move forward, we can see Indigenous nursing students at the master's level being supported, as well as regular Canadian nurses both being supported to be able to just have a little bit less pressure financially as they try to dig into that research and that work.